Public Service Department Director General Wan Ahmad Dahlan Abdul Aziz said more than 40,000 civil servants were at high risk of psychological health problems.
Was these voices inviting me to the balcony, and it's just drawing me to look down, and there was a time I really wanted to just go down there because it was so peaceful.
Prior to the pandemic, the National Health and Mobility Survey in 2017 showed that 1 in 5 teenagers has depression.
There will be times, certainly in the future, when a machine will read someone's previous electronic health record, pick out the salient features like the comorbidities or illness characteristics, and recommend a treatment to a clinician.
Hi, I'm Jira. This time we talk about mental health, and this time we take it seriously. Mental health issues are peaking at its highest in Malaysia. 1 in 3 Malaysians are affected by mental health problems in Malaysia. Mental health is our emotional, psychological, and social well-being. It is how we think, feel, action. It helps determine how we handle to stress related to others and make health choice. Just like our physical health, it is important all people and any age group. Why is mental health is important? Having good mental health makes life easier. It helps us to calm and comfort ourselves when we upset, to cope with to lose, change, fears and uncertainties in life, to make and keep good relationship with others people and to learn. Having good mental health does not mean feeling good all the time. So please take care of yourself. Don't stress, okay?
So I would like to talk about the mental health in Malaysia emerging technologies. For the first point is digital mental health platforms. In Malaysia, mental health support is growing through apps and online platforms such as Thoughtful and Plus Vibes. These apps connect users to licensed therapies and self-help resources by making mental health care more accessible, and especially in rural areas. For the second point is telehealth services. The idea of services is to allow Malaysians to get mental health support through video calls and online consultations. This became more popular during the COVID-19 pandemic and continues to be the convenient option for many people. For the third point is artificial intelligence, AI. AI is being used in mental health tools to assess emotional well-being. Chatbots powered by AI can offer initial screenings, track symptoms, and provide immediate support to those in need. For the fourth point is social media. Social media plays a key role in raising awareness about the mental health, as seen in campaigns like #OkTakOkay. However, if we use too much social media, it can lead to issues like anxiety and cyberbullying. The next point is visual reality and augmented reality. For visual and augmented reality, these are being tested to treat anxiety, PTSD, and phobias. These technologies create safe spaces for therapy and relaxation. It also helps people face their fears and in a controlled way. For the last point is data analytics in mental health. The big data is helping experts track mental health trends and understand where resources are needed most. It also helps identify groups that may be at the higher risk.
Assalamualaikum, my name is Akina and I will talk about the importance of the record management in mental health services. We will explore how advancement in technology are transforming the way records are managed while addressing the key issues like the confidentiality, interoperability, and security. Okay, the first one is digitalization of records. So in Malaysia and mental health services in Malaysia, we are moving away from the traditional paper-based to the electronic health records or EHR. Why this is important? Because first, it's improved efficiency by making information readily accessible for the healthcare providers, and it's ensured that the critical patient details are available when needed, such as their history and treatments, to reduce the chances of the errors, and also it's reduced long-term costs associated with managing physical files. It's make it easier to analyze the data, so it's improved the service. Our third point is interoperability. This means the ability of different systems to share and use health data effectively. So mental health care often overlaps with physical health care. For example, patients with chronic conditions might also require mental health support. So by linking the mental health records with the general health records, healthcare providers can offer more holistic approach to diagnosis and treatment. So imagine a scenario where the mental health professional works with the hospital to create a treatment plan that address both mental and physical health issue. It's going to work so very well and very effective. But however, there are challenges to this by ensuring that all the system use compatible data formats and balancing data sharing with privacy. But when done right, interoperability significantly improve the patient outcomes. The next is the confidentiality and the data security. So mental health records are extremely sensitive. It's contain the private information of the person's mental health condition and treatments. So in Malaysia, we have law that secure the sensitive information, private information. We call it in Malaysia, we call it the Personal Data Protection Act 2010 or PDPA. It ensures that the information is handled securely. Violation of this act can lead to the serious penalties and loss of trust between the patient and the healthcare providers. So to protect this data, the healthcare facilities use tools like encryption and secure login system. Equally important, it's training staff regularly, so it can prevent mishandling or breaches of data. By safeguarding patient records, we create a secure environment where individuals feels confident seeking mental health support. Okay, lastly is cloud storage. So many mental health care providers are now adopting cloud-based system for managing records. Why is it important? It's because cloud storage allows healthcare providers to access records remotely, which is especially useful for telemedicine services or during emergencies. It's ensured that the data is backup and protected against physical disasters such as a system crash, system hack, or floods. So to keep the data safe, system use measures like multi-factor authentication and encryption. So the cloud data is also cost-effectively scalable, meaning it can grow with the organization's need. So this technology is not only enhances the data security but also enables more flexibility healthcare.
Next, I will continue with the cause of mental health. Firstly, social isolation. Prolonged periods of social isolation or a lack of meaningful interactions with others can lead to heightened feelings of loneliness, sadness, and anxiety, which in turn may significantly worsen pre-existing mental health conditions such as depression, further impacting overall emotional well-being and quality of life. Secondly, the experience of bereavement, which involves the loss of a loved one, can trigger overwhelming and intense feelings of grief that may develop into serious mental health challenges such as depression, anxiety, or post-traumatic stress disorder (PTSD), potentially disrupting an individual's ability to cope with daily responsibilities and maintain a sense of normalcy if the emotional distress is not adequately acknowledged and addressed through appropriate support systems or interventions. Next is the issue of workplace violence, which can include bullying, discrimination, or other forms of mistreatment by colleagues, supervisors, or even the organizational culture itself. This toxic environment can lead to persistent feelings of helplessness, a significant decline in self-esteem, and chronic stress, all of which can profoundly impact an individual's emotional and mental well-being. Over time, these effects may disrupt professional performance, hinder career growth, and make it increasingly difficult to cope with daily responsibilities, particularly if the hostile behavior continues unchecked and adequate support or intervention is not provided. Next is drug and alcohol misuse, a serious issue that can profoundly impact an individual's overall well-being. These conditions often impair essential coping skills, making it increasingly difficult to manage stress and life challenges effectively. Additionally, substance misuse can exacerbate existing mental health conditions such as anxiety, depression, or mood disorders, creating a vicious cycle of dependency and emotional instability. Over time, this cycle can disrupt relationships, professional responsibilities, and physical health, further complicating the path to recovery and emotional stability. And lastly, unemployment, which can have far-reaching effects of an individual's mental and emotional well-being, often leads to significant financial stress, a diminished sense of purpose, and pervasive feelings of isolation or inadequacy. The loss of stable income and professional identity can exacerbate anxiety and depression, while the social stigma or perceived failure associated with unemployment may further erode self-esteem and motivations. Over time, these challenges can create a cycle of emotional distress, making it increasingly difficult to seek new opportunities or maintain a sense of hope and resilience.
There are 5 effects on mental health in the workplace, which are lack of sleep, depression, stress, anxiety, and OCD. I will be explained one by one. Firstly, sleep is essential for the body to have a regular sleep cycle in order to optimize the function of the brain. Not having enough will stop the brain from resetting properly to prepare for emotional challenge the next day. Secondly, depression is a long-lasting low mood disorder. Depression can affect a person's motivation to do or enjoy anything, which can slowly deteriorate one's physical health. Thirdly, stress can be cause or trigger for poor mental health. Stress can become overwhelming for an individual, making any existing disorder worse or frustrating to cope with. Fourthly, anxiety can be feeling of stress, panic, and nervous, preventing one from doing his everyday tasks or entering social setting. Instead, an overwhelming period of anxiety may trigger a panic attack. Lastly, OCD is an anxiety or disorder in which unwelcome thoughts or worries are continually repeated in a person's mind. Compulsive behavior are carried out to reduce the anxiety caused by their repetitive thoughts.
Next, I will continue for the solution and recommendation. Government and Ministry of Health should improve more on mental health issues in Malaysia, especially through the integration of developing and emerging the technologies that may require a multi-type of the agency. There are solutions or recommendations that can be include technology integrations and record management strategies and can be improved on the mental health issue to be more efficient and more quality for the mental health issue. The first point of solution and recommendation is training and education. Government and Ministry of Health can equip a mental health professionals training in digital tools and also in the technologies. It can be accessed for all of the Malaysian people and can be used for the 24 hours for the service. And the second one is the virtual reality and augmented reality therapies. Can introduce the VR and AR technologies for the therapeutic application, and it can be a good exposure therapy and to treat a PTSD, anxiety, phobia, and also for the stress release exercise.
Now, I continue about solution or recommendation which dedicate for mental health issue in Malaysia by developing and emerging technologies and record management. Next is develop comprehensive digital mental health platform that offer teletherapy, online counseling, and self-help resources such as utilizing mobile apps for cognitive behavioral therapy exercises, mindfulness training, and mood tracking. Then create localized apps tailored to Malaysian cultural context and languages, and also provide AI-driven chatbots like Lisa Warwood as the first line of mental health support for basic counseling and guidance in Malaysia. Furthermore, implementing the AI tools to detect early signs of mental health issues through pattern in speech, text, or online behavior, which deploy sentiment analysis tools in social media monitoring to identify individuals at risk, and integrating AI algorithms in educational institutions to detect stress or anxiety for students in Malaysia. Lastly, encourage the adoption of wearable devices to track psychology signs like heart rate, sleep pattern, and stress level, which is collaborating with tech company and government clinic to offer affordable devices tailored for mental health monitoring and using the data to personalizing therapy plans among citizens in Malaysia.
For the conclusion, Malaysia is leveraging developing technologies to enhance mental health services and record management. While there is significant progress, challenges like ensuring equitability access and maintaining ethical standards need to be addressed to ensure a sustainable growth in this sector.